Hello and welcome to the Hardy Brain, the show that takes athletic, introverted entrepreneurs and leaders and transforms them into ironclad brain performers. I'm your host, Dr. David Hardy. And today on our show, we've got another amazing guest. She is the owner of Symphony Brain Performance in Nanaimo, BC, Canada, as well as the founder of Concussion Nerds, a 6-month concussion program mentorship for clinicians. And she is on a mission to evolve the conversation and culture around concussion. Welcome to the show, Natasha Wilch. How are you doing today?
I am great. Thank you so much for having me. I'm excited to be here.
Absolutely. Now, why concussions? So you're a physical therapist and you've got all these skills. Why are you focusing on concussions in Canada?
Okay, I'm going to try and give you the Cliff Notes version because I can tangent on this for so long. So it starts as a personal story, I think, which does for a lot of us. And then it kind of just evolves to the continued inspiration for my clients today. So when I first became a physio, I actually worked in stroke and spinal cord. So my cousin became a quadriplegic at a very young age.
Oh, wow.
And so he inspired me to go into physical therapy because when he talked about the people who were really impactful on his life and his journey, it was the therapists that were huge. So that's where I first went in the physio space. But when I was 17, my dad had a brain injury. So a log rolled off the back of a truck on his head when he was at work. And let's just say that kind of turned our family upside down. He was in the hospital for a month, maybe a bit longer. It's kind of all of a bit of a blur. This is going to, I'm 42. I don't do math. So however many years ago that was, people didn't educate us back then. Right. So they didn't educate my mom on what to expect. They didn't educate my dad on what to expect and how this could impact his life. And so no one sure as heck told the stubborn type A 17-year-old daughter how this could impact my life and my relationship with my dad. Long story short, it actually ended up that led to me moving out of my parents' home when I was 17.
Oh, wow.
And so there was some very rough few years. I am grateful, lucky, and blessed that my dad and I have been able to rebuild our relationship, and it's in a beautiful place now. But it actually it caused me to grow up a little faster than I had to. And so then that kind of got tucked away and forgotten, ignored for a long time.
As it does. Yes. Yeah.
Right? And then when I was in Nanaimo, I actually started Symphony because we transferred here for my ex-husband's work and I couldn't find a place to work because I didn't want to work in the hospital system. And there was no clinic in Nanaimo that focused on the neurological population. And so I was well, there's got to be there's old people that live in Nanaimo. There's got to be a place for people to go after they have a stroke.
And there was nothing.
There was nothing.
And I've heard this after city is that they'll get the acute care in a hospital, which is limited because they're busy places and they're trying to get you out.
Yep.
And then afterwards, hey, family, take care of them.
Yeah. And Nanaimo, we're not a huge town, but we're 90,000 people in Nanaimo alone. And then we have neighboring cities, towns, not very far away. So there was nothing here. And so I started Symphony. And then doing stroke, pretty much stroke, Parkinson's, MS, and spinal cord were my core. And then there was this lovely occupational therapist. And it was, I'm never going to forget the client. And it was 2017. And she referred me this client who had a concussion and wasn't healing. So she was in a persistent concussion state. And this woman sat in front of me and I was like, when you feel like a deer in headlights?
Right.
That was me. And I looked at this client and I just said to her, I said, I'm going to be brutally honest with you. I have no idea what to do. I said,
right.
But if you're willing to work with me, I'm willing to learn. And I always say, I think it's because she had nowhere else to go. And thank gosh she didn't, because I took my first course that weekend.
Now on this point though, this is what I commonly hear from concussion patients and so many people out there who have something going on, and brain health is massive. it is a lot of the population who's suffering. And it's even starting to be recognized by like G7 countries at their next forum and by Davos of all places. But on that point, commonly what I hear is that, yeah, my neurologist knows neurology but doesn't know therapies. And who's ever doing the therapies knows therapies but have no clue about the neurology. And they're in this vicious cycle, or they're put on the drug merry-go-round.
Yep.
What have you seen with patients coming through that is just a struggle for them in this system that is letting brain injury people fall to the wayside?
Yeah. A lot of what you said, the stories, and you probably hear them too, the stories you hear are horrible.
Oh,
right?
yes.
And when we look at like what fuels me today, it really is some of these stories, the shaming that happens, the gaslighting that happens, like it's disgusting.
It is.
And it really is, it's what you're saying is like people, there was a time, you remember, let's say like even like 5-6 years ago, you'd Google concussion and there would be nothing. Like it was hard to find anything to do. And today, so then people were stuck. So they're like, well, what do I do? Like, I don't know where to start. And then now today you Google concussion and everyone and their dog treats concussion in some way, shape, or form. And it's just as confusing because now you're like, what do I do? And what I will say, and I think what I love about kind of the work we do too, is this piece of when things are in a persistent stage, we have to have the ability to understand the neurophysiology. We have to understand how the things link and how they work and how they relate to function. And we have to have that depth of knowledge. And what I see a lot of the professions have, and it's not to bash on them at all, but they have a breadth of knowledge that can get a client to a certain point, but then they don't have the depth to take them further. And then what ends up happening is some of those providers just discharge, but then that's where the narrative of this is as good as you're going to get.
Oh,
this is your new normal.
Yeah.
And I'm always like, can I swear first? Am I allowed to swear on your podcast?
Go ahead.
And I'm always just going to hear that. I'm like, shut the fuck up.
Yes. Thank you.
Because if someone ever told you or I that this is as good as you're going to be as a human, we'd look at them and tell them to fuck right off because we are constantly evolving. And healing is not just one thing. And so to tell a client that this is your new normal infuriates me like no tomorrow. But our clients, and you probably see this too, they're determined individuals. Clients today have to do so much of their own research, which is unfortunate. And there's so much distrust in the system because they've been screwed around by so many providers usually that they feel like they need to understand everything themselves to understand the type of care they're giving, to then trust in that provider to be able to heal. Like it's such a...
Well, let's dive into that because there's so many different professions going into concussion and saying it as you mentioned. And a lot of it's kind of protocol based or we've had some successes with this. But there is a lack of overall credentialing around this, correct? Like, where are we at?
Absolutely.
Like somebody who does a weekend course on concussions versus learning pathways neurology that takes years
hundreds
to get to.
Hundreds of hours that we've done.
Right. In functional neurology. Yeah. And it's not recognized in Canada.
Nope. Sure not.
Yeah. So where are these patients? They go to kind of trusted fields that they've always kind of been referred to. And then too, there's the whole issue of private versus public. And to be honest, most concussion brain injury patients now are kind of walking that line of, oh, well, I have to look and set funds aside and this isn't covered by the regular system. What's your perspective on this?
Yeah, I mean, when we look at the public versus private, and we're both in Canada, so we can actually, I understand what we're talking about.
And I've practiced on both sides of the border, both the US and in Canada. So Yeah,
It's
it's
this,
amazing the difference.
it's so in Nanaimo, let's talk about my own town, for example.
Yes, yeah,
We have a concussion clinic in the hospital.
right.
I don't know a single person that's gone to it because the criteria, so they have an extremely small budget. So I'm pretty sure it has an OT. Oh, this is going to totally tangent into something else too. But this is
Fair enough.
so it has an OT and I think a neuropsychologist or something funky in this thing. But they won't treat anyone that has alternate forms of funding like ICBC or WorkSafe, so they don't take those. So the criteria to be seen by the public system is so small, and it is also so underfunded that they can't actually treat. It's
Right.
education and management.
Wow.
And I think, and so clients, and concussion isn't significant of an injury enough, I put in quotations, to qualify for anyone to be in any inpatient or outpatient rehab programs, because most individuals can still function and do ADLs. And let's be real, like the hospital system is to get you back home. And once you're home, you're out of the public system.
You're out.
Right? So everyone's falling into the private system, which is what all our clinics are, even whether you take insurance or not, which we do take insurance, but there's only a certain amount of insurance money a year as well for someone to use. And you have to, when you look at, depending on how the impact of concussion, so many of our clients don't have the ability to work because of the symptoms of their concussion. And now they have to pay private funds. And it's this vicious cycle for how they can get the care they need. And yeah, it's definitely a struggle. Like all the clients that work for my intensive program, that's all private pay out of pocket.
Right.
Right. And but it's funny when you look
and
at
almost it needs to be. And
yeah.
I'm going to say that blatantly is because protocols are how the regular system is run. And
Correct.
if there isn't a protocol, it's outside standard care. And individualized care, though, which is what's needed in a concussion, isn't going to be protocol based. It's going to be observational. It's going to be looking at biomarkers. It's going to be change it as the patient changes.
Yeah.
All the things that would actually help healing and get people better in the split second world of the nervous system.
Well, and I always
do you kind
say
of see it as the same then?
It's so much, and when you're like protocol based, it's very black and white, right? It's there or it's not there. And anytime concussion is not, it's there or it's not there. Concussion is, we're playing in the gray.
Yes.
Is how I always describe it. We're playing in the gray zone. We look at the nuances. We look at the asymmetries. We look at these, because it's not yes or no. It's everything in between.
Right.
And protocols don't let us do that.
No. So how are you explaining this to clinicians then that are, well, I want to become better at this. Like I'm not serving my patients right. So where does this come in with Concussion Nerds?
Yeah. So it's funny. It's like, I'm like, you're a chiropractor, I'm a physical therapist. And I don't know about you, but physical therapists in school are like taught to hate chiropractors. I'm pretty sure it's vice versa too, to be honest. And I do believe like in this concussion space, like we need a village. We need to have people that we can bounce ideas off of. We need to have people we can work with and collaborate with. But when I did my first Funk Neuro course in 2019, I think. And it's funny because I remember one of my physio colleagues saying to me, well, Natasha, it's taught by a chiropractor, so do you think it's legit? And I was like, I just remember being dumbfounded. And I was like, well, I'm going to try it.
Right.
And
yes.
I'll make my decision from there. Like, so I've done a ton of I've done stuff in functional neurology. I've done stuff in neurooptometry. I have a huge passion for trauma as well. So I look a ton at polyvagal theory and all these different elements. And I've kind of like mishmashed it all into how I approach concussion care I very much work with persistent clients more than acute. I do both, but much more persistent. And so when it comes to the physical therapy space, when I was looking for something, to help me. I recognized I needed the depth, right? So it was that piece of my clients were getting better. We were still like, we were becoming that like go-to clinic locally. But you know, when you can just that you're like, I'm missing something and you're like,
Right.
I know I could be doing this faster. Like I know I could be doing this better, but I don't know what that piece is. And I was really, really struggling to find something. And in the physical therapy space, when I started looking at any concussion course, none of them were going deeper than what I was already doing. And I recognized I needed that depth of understanding, which is what led me to the functional neurology world. So then after a few years of practicing and like mishmashing all my stuff together, it was this piece of there's still nothing in the physical therapy world to help providers who are open to a different way of thinking and are willing to invest in depth.
Right.
And then when it's also me recognizing like what were the key components of my learning journey that really helped me integrate things into practice. And so it was like the didactic, like learning piece was really key. But then having mentorship and having someone that I can bounce things off of and having the ability to see it in practice, like these elements were all components that helped me put things into practice smoother and faster to start operating changes. So then I kind of took a step back and I was just like, I don't need to recreate the Carrick Institute because no one's ever going to go deeper than them. But
it is a deep dive.
It is a deep dive. And I was
Yeah.
like, and a lot of people aren't ready for that. Like, let's be
Right.
honest. Like a lot of
Absolutely.
clinicians are not ready for that. And that's okay. And so I was like, but I need to take people deeper than what we currently have available. And so that's what Nerds is. So Nerds is kind of this, I created this program because the physical therapy space desperately needed something that gave people a new way to look at concussion rehab from a multi-systems integrative approach, from a holistic standpoint as well. So yes, we go into the physiology, but we talk about lifestyle, we talk about psychology, like we talk about all those pieces from that holistic model. And so they have this didactic portion. And I say I have a framework. It's very loose because it's
Because
not a
it
protocol.
needs to be adaptable.
Yeah.
Yeah.
And then we have I live mentor in the program every month, and we have a private community to bounce things off of. And we have an in-person workshop weekend that is part of it as well that they can come to. And they have an invitation to come shadow me. So I really created this program that, and initially I thought I was going to do it all in 3 months. And then I realized that wasn't long enough.
Never
They're like
is.
drowning in 3 months. I was like, okay. And then the beautiful thing is if someone's ready to go deeper after Nerds, then I can pass them on to stuff that like we've done.
Right.
But it really is that next. It's great for someone who it's their first thing they've done, but it's a little more overwhelming if it's the first thing someone's done. I'm not going to lie. But it's also that kind of next step in the depth to get that piece of things. So, we have people who've come through Nerds. We have acupuncturists, osteopaths that have come through, chiropractors that have come through, obviously physical therapists, because that's what I am. But that's what led to Nerds. And it's really cool. The first like moment when I sat back where I was like, okay, I'm creating something that's going to help people is when I started having, I had both a client, someone who I had no idea who the heck they were on Instagram, reach out to me, and they were like, "Hey, Natasha, do you have any concussion nerds in Pennsylvania?" And I was like, okay. It's like people are recognizing that what we do is different.
Yes.
And that it's making a difference in people's lives. And that's really fucking cool.
That is cool.
So yeah, it's a huge passion of mine. It was that piece of, if I want to impact people's change in people's lives who are on this healing, when I say I was on a healing journey, I don't say concussion survivor. So I say
Right.
for people that are on a healing journey, I could create a program that's specifically for them, which I do have a program specifically for them, more from an educational support, not a rehab program, online. I said, but if I really want to help impact those people, who do I actually need to be supporting? And it was going back that level to like, well, the clinicians, because I can only treat so many people. You can only treat so many people. But if I can train hundreds of clinicians, then that's helping thousands of people. So
And we mentioned concussions, but we're mentioning brain
brain
disorders
health as a whole. Yeah.
as a whole. And in healthcare, they really like to put things in a box.
Oh
Oh, you can
gosh.
treat this disorder. This profession can treat this disorder.
Oh,
Instead of, once again, kind of the whole system, how it works. Can you kind of go in then with these different professions coming in with, different lenses, but how some organizers or bureaucrats really want to push an integrated office where they don't even know how the system would work, that it would be, okay, well, you go do this therapy down here and then this therapy, this place. And how confusing that is then for people, and how it can fall
mhm.
apart in care wise. And because
Well, and
vestibular therapy is not concussion therapy, correct?
correct. Very correct. And yet, vestibular therapists are some of the leading therapists that currently get referred to for concussion, but it is
Right.
one element of
One
what concussion
tool.
therapy can be.
Right.
Yeah, absolutely. And you see it all the time, right? You see these integrated clinics that, like, we're a multidisciplinary integrated clinic, which is great. We have PT, we have OT, we have chiro, we have neurooptometry, we have all these things, except in most of, not all, there's some that I know, like, but in most of those clinics, they're still operating as a siloed approach within their profession, just within the same space.
Right. So it's no
And
different than a patient going to multiple different offices hoping to find a solution to what's going on.
yeah, and I think it's the piece of, when I'm when we talk integrated, and I know when I say integrated, you know exactly what I'm talking about, but like when we talk integrated, it's not, it's, I always say we're dancing and weaving between each of the systems, every single appointment, minute to minute, second to second. And so I'm not someone that's like, I'm the only provider you're going to need. Like, that is absolutely not the way I
Right.
think.
Oh, yeah.
But
Understandable.
in terms of like that physiological, like, element of things, like, it's great when you hear it from clients. And it's, I remember that I have this client that comes, she comes from North Carolina, and she had done, a bunch of years, like a couple of years of vision therapy leading up to, and great respect for our neurooptometrists. We refer to them, we use them, we work with them. But she kind of plateaued in vision therapy and had been really stuck and wasn't making changes. She had a team that I have huge respect for, her team, that looked at her and said, honestly, like, we're not saying you can't get better, but we don't know how to help you. And so they discharged her. And I said to her, I said, that is a solid practitioner right
Yeah.
there. Anyways, she came up and we put her through our program. And because we do all the things, her vision improved more in our week and she'd been stuck and plateaued out. It's like, and we see that over and over and over again, right? Like, and it just goes to show the power of, we are an integrated human being. So how do we think we can break these things into boxes and just treat the box and not how they stack together? It's
So,
kind of
how
how,
would you briefly describe functional neurology to someone who's never heard about it then? So, we've really kind of gone around, okay, well, what's not working in concussion, but what
yeah.
is kind of the approach that has, in our experience, helped a lot of people out? And yeah, maybe there is more that can be added, but what's kind of terms or phrases do you use to get this across to people that do need this care?
Yeah. You know what, it's funny. I don't use fancy terms. That's really lay language.
Right.
And I'll usually ask people, because I'm never the first provider. Like, you're probably never
No.
I'm the first provider, or provider number 20, 40, whoever knows.
Yeah,
They
and the
basically, people who
placebo
end up,
effect's gone after one or
it's
two
gone.
practitioners. Like, it's not
Yeah.
placebo.
No. And it's like, and people reach out to me usually once they've exhausted everything where they currently live, right? So,
Yes. Yeah.
and so honestly, it's a very frank conversation of, they share like what they've done. And I said, it sounds like, they're stuck. And I said, it sounds like a little bit like we haven't gone deep enough and we haven't talked about how these systems talk together. I said, what you've had before is providers who've kind of done these like individual kind of pieces. I said, what I do is take a step back and I look at the full picture of you. I look at what's working really well in each system and what's not working really well in each system. And then how are they talking together? Are they playing nice in the sandbox?
Right.
I said, that's what gives me the ability to then treat as a whole person instead of these small pieces.
Yes.
And then I'll be like, so our first day together is that really deep assessment so that I can find that information out. And then we build a treatment plan and go from there. And that is honestly usually enough for someone to be like, no one's looked at all of me before.
Right.
And it's that piece of, it's really kind of talking about like, how are these things talking together? And then sometimes I'll use the Chinese telephone as an analogy, right? I'll be like, do you remember playing Chinese telephone when you were a kid? I feel like people our age do. Kids younger than us don't, but I'll be like, so you like start a message and then it goes to the next person and it's still clear. And then it goes to the next person and it's still clear. And then it goes to the next person and something changes. And then it gets to the end of the line and it's a completely different message. And they're like, yeah. I said, well, let's think about this on how your brain functions and the concussion. I said, comes in, clear. I said, there's many stop points things have to go to before in your brain to get processed before you have an output. And that output can be mood, like movement, talk, whatever it is. I said, so imagine along one of those stop points, something's not working great. Well, now the thing gets muffled and gets distorted. And then that distorted message gets passed along. And then that gets kind of trending. And like I said, the outcome, I say like ultimately your symptoms. I said, my job is to figure out where along that pathway things stop talking nicely together. And then we treat around that.
Perfect.
And I always try to make the difference between so much of treatment today, particularly around the nervous system, is management. So then I try to paint a very clear line between there's management and there's treatment. We need both. Right. But if you're just doing management, you're going to be doing management for the rest of your life. We also need to treat. And so then we have a conversation about what the difference is between those two things.
And it is a big difference. Now, of course, you're kind of extremely busy. You're an entrepreneur. You're trying to innovate in a system that doesn't like innovation. And how do you keep track of your own brain health? Like from a peak performance standpoint here, because brain is such a continuum. And just like we stated earlier, if somebody said, this is where you're at, we'd be like, no.
Yeah.
And right now, though, there's got to be feelings of overwhelm, stress, pressure, and you're taking it on like an athlete or as a CEO. So what are the peak performance aspects in Natasha's own brain health care?
It's going to be really boring because it's not sexy, right? And it's this piece of, this is where consistency and discipline prevail, right? Everyone I think in brain health is looking for like that hack or like that thing they can do that's going to make everything better.
Well, sometimes there is though.
Sometimes.
Yeah.
But then you have to continue to show up for yourself and you have to understand what works for you so that you can perform the way you want to perform. And I've shared in other things and in my world too. So I went through a huge period of trauma healing, which was actually probably my kickstart to taking better care of myself, to be honest. And so today it's truly finding the things that I know make a pivotal difference in my health, both in how I show up, how I feel, my energy levels, my sleep. And those are my priority. And for me, truly, it's not very exciting, but like physical exercise, absolutely a must.
Yes.
Nutrition, huge. And sleep. Like those are truly like if I had to say three things, I also meditate, I make sure I drink water, I take supplements, like I do that stuff too. But like really the three fundamental things that are non-negotiable in my life are exercise, nutrition, and sleep.
It is
And
the combination, absolutely.
right?
Like
And
that's the
people
foundational
it
of
is. And
all
people think
health.
I'm funny sometimes when I'm like, also, you have to be your priority.
Yes.
You have to. And people are like, I have an 11-year-old son. And people are like, well, is your son your number one priority? And I'm like, no, I love my
Yeah.
son to pieces, but no, I am my number one priority. Because if I don't take care of myself, I can't be a good mom. If I don't
You
take care of
can't.
myself, I can't run my team. I
Right.
can't do the things I want to do. And I want to do a lot of things in this world. And so it's funny now because I have a girlfriend that'll be like, I'm just leaving the gym. She's like, you're so damn consistent. And I'm like, it's not even a negotiable in my world.
Right. So, for the people who are interested more about what you do and how to get more information, where do they go?
I'm going to say the two easiest places because there's a lot. So my podcast, the Concussion Nerds podcast, if you're interested in some of that more concussion-y stuff, but brainy stuff, Instagram is always an easy way to reach me. So it's at natasha.wilch or my website, which is just natasha-wilch.com. And
I
I answer
love
all
it.
the messages and email messages that come through any of those platforms. So
Wow. That's a big commitment as well. Well, I appreciate your time, your enthusiasm, and what you're doing to be that patient advocate for people that are struggling and that need care. And not just that, training others so that more people get help and better. So once again, thanks for sharing that passion, that mission you have behind concussions, behind brain health, and your enthusiasm. So definitely check out Natasha and stay tuned to the next episode of The Hardy Brain, the show that takes athletic, introverted entrepreneurs and leaders and transforms them into ironclad brain performers. Take care.
thank you.